So good morning, Charlotte. This is Dr. Noyes, and
Good morning.
good morning. And Charlotte, you're kind of a special patient because why don't you straighten out your knees and look how nice that looks. And you've got some very good muscles there. You've been working hard for that.
Oh, yeah. Yeah.
And then 2 years ago, you had surgery on both knees about 2 months apart. And can you tell people what type of surgery you actually had?
Patellofemoral?
Good. That's a big name. So your kneecaps were worn out.
Yes, yes.
And so we replaced one, and then that worked out pretty well.
Yes.
And then we replaced the other one. And prior to the replacement, you were actually down to bone.
Mm-hmm.
And you said your kneecaps, what would they do when you try to straighten it out? They'd crack and crunch?
When I go up steps, I started for the last couple of years before surgery, I would have to pivot if I was in the driver's seat of my car. I'd have to pivot so I had both feet on the ground facing out because I couldn't come down on that left foot and rotate to get out because it was very unstable.
And stairs and squatting?
Yeah.
So you had the full range of cracking, stairs, pain, and you were active all your life. And so when we talked about it, you went for about 5 years before surgery, kind of putting up with it. That must have been difficult for you.
Just giving up running and things that I enjoy doing.
Okay, well, we're going to fast forward because now you're out 2 years.
Mm-hmm.
And how are you doing?
Great, great. I teach Pilates, so I can do lunges now. Before the surgery, I quit doing even Pilates activities that, I couldn't do a lunge and push back on the spring tension weight before, or squat without my knees. It seemed like the knees were just shaking and unstable and buckling. But very strong now, and I can walk 5 miles at a really fast pace, hills, that sort of thing. I do the elliptical and the rowing machine every other day, half an hour each.
So that's really a committed recreational athletic program.
Mm-hmm.
And in the interest of just full transparency, we've said we are so happy that you almost have like normal knees. And so we said maybe we should cut it back just a little bit.
Yep.
Because you have had replacements, and we'd consider you an A knee. And so maybe 45 minutes of that aerobics and ellipse and not the full 60 minutes. But you're doing Pilates, and you said you even got out in the tennis court a little bit to
Yes.
hit the ball. You didn't want to tell me that, did you?
No.
Okay. And I guess the other thing is, how was surgery for you? Because we do this through the robot, and we do it through a minimally invasive, a very small incision. And how did you do from surgery?
I was pleasantly surprised. I went home the day of surgery with both knees. And I can't really even say that I had pain from the surgery. Didn't really even use the pain meds on a regular basis. And pretty much did away with them after the first week.
Right.
At post-surgery.
You had a great result from that.
Yeah.
And again, in the interest of really saying, now we've taken a number of patients through that. And I will say, for every patient like you that has gone through it with really minimal pain and great response to rehab, there is another patient that really has to work hard for that first 6 to 12 weeks. So it still is knee surgery, even though it's minimally invasive robotic surgery. Mm-hmm. And it really does require a good 6 months of rehab afterward. And I think those muscles really started to turn on probably about 6 months after your surgery, would you say?
Yeah, maybe even sooner.
Maybe sooner on you.
Okay. I think early on I had trouble with turning on the muscles,
right.
And so right after surgery with the left, because there was a release on that one.
Right.
I think it took a little bit longer for it to turn on, which was very strange.
Right.
To me.
So just in summary then, you really had a congenital form where you were born with your kneecaps halfway out of joint. And it's like a tire, and because they were halfway out of joint, they actually wore down completely through the bone on both sides.
Mm-hmm.
And so we actually had to do double surgery. We did the replacement, and then we had to balance the ligaments, almost like a cross eye. We had to get the ligaments balanced so that they could work. And then you did something very important. You backed that up with good muscle rehabilitation and muscle strength. So I'm really pleased that you've done it. I guess if someone else was in your same shoes, would you tell them to maybe do it a little bit sooner than you did?
Definitely, yes.
Yeah, what we're finding with robotic surgery, and again, we never want to talk people into surgery, but what we find is that there's a tendency to put it off and to go through 3 or 4 or 5 years of disuse and not being able to do the things you want to do. So I think you would be, you're a good inspiration for people to say, don't put it off too long. To maintain that active, healthy lifestyle. I think you're a great example of that. Well, thank you so much.
You.
Thank you for sharing our story. I think you'll help other people.
Thank you for being here to do it.
Thank you. We appreciate that. And I have to say, we have a great rehab team, don't we?
Oh, yes.
Aren't
Christy
they the
and
best?
Jim were mine.
Yeah, they're the best. They just take over with our patients, and they're so compassionate and provide so much care.
So is Donna.
Yes. Great. Thank you so much.